Hey, hi there. So it's me, Grandma Shark MD. As you know, I am a pediatric emergency physician for 30 years now. And I am building this channel to hopefully retire from being in the ER. But, you know, uh, life has brought us the COVID 19. Epidemic, pandemic, and so I haven't been able to have time to work on my channel. But I was hoping that you might want to hear a little bit about what's going on with COVID-19 and what the medical response is. First of all, it's a little bit haphazard, unfortunately. Different states are doing different things, but we are now seeing exponential increase in cases, especially in the state of New York, and coming in any of the large um, uh, high density cities. Um, but that doesn't mean that people in other areas don't need to uh, heed the quarantine and stay home and wear gloves and wear masks if they can. Because we're somewhat unprepared for this, in the emergency rooms, we're running out of the N95 masks. So we're being asked to reuse them. You can see I wrote my name on mine. I anticipated that this was going to happen a couple weeks ago and grabbed this one, so I knew I would have it. I really only need to wear this when I go into a room with a patient under investigation. That's what we call it, PUIs. And they don't have to be that sick. They can have a fever or cold. I think we're going to probably be moving towards triaging those patients outside of the emergency room or just up front. And when you get there and we see that you don't need oxygen, you don't need, anything but maybe some Tylenol, we're going to tell you, go home. Because we may have testing available for you, but at this point, I think they're still trying to preserve the test for patients who are, ill in the hospital, to confirm that, and also healthcare workers, so they know when they have a healthcare worker who is ill, that that healthcare worker should go home and be quarantined, or only work with COVID patients if that healthcare worker isn't that sick. I mean, I think that might be another solution that might have to happen, because I know that we're going to have a dire need for more doctors and nurses. I know my phone is ringing off the hook with recruiters asking me to, work here and there. So that's why I haven't had much time to build the website and build the YouTube channel. But please subscribe to my channel, and email me at grandmasharkmd@gmail.com. I'd really like to know if there's somebody out there who's out of a job, who's really good at building websites or building YouTube channels. I'd like to hire you so that I can start getting this done. I feel like I'm really getting behind on what I'd like to get done with that. So also, I made this little mask to go on top of my mask, and I made it from some material I had around the house. Actually, I actually made this from a dress that I was going to donate to charity, and it was sitting in the donation bin. And so I thought it was kind of cute. See it? Look at that. And this will help prevent me from touching my my mask. So mask on mask is one of the things that the ER doctors are doing. I love ER doctors. They're so innovative. They're figuring things out. They're not waiting for somebody else to help them. We're making what you call it, drapes out of plastic bags, and we're making our own masks. There's an organization of people that are sewing a whole lot of masks and sending them to hospitals. So that's awesome. You guys are awesome that are doing that. Um, and that's what we're doing. That and we have a saying in emergency medicine. We call it MacGyvering it. There was a TV show called MacGyver back in, I think it was the 80s. It was a long time ago, maybe even in the 70s, 80s, where MacGyver would always figure out how to get out of a terrible situation with like a paperclip or some other thing. And that's how ER doctors are, where we figure things out. We're figuring out how to multiply our ventilators so that we could put 4 patients on one ventilator if we have to. Not ideal. These are not ideal, but we're doing it because we've been caught off guard a little bit on this pandemic, unfortunately. And I'm not going to get political, but I think people who know me know my feeling about it. So yeah, make masks if you can. Also, you can make this mask if you're sick, or someone in your family is sick, or you want to protect someone in your family who's at risk, someone who's elderly, someone who's immunocompromised. You can make a mask. It's like, oh, all the masks are gone from the store and I don't have anything. You can make them, or maybe reach out to one of the organizations that are making them and explain why you need them. It's awesome. I made this and another one. I made it out of a dress, and then the inside lining is this from a really nice cotton shirt that I had. It's really nice and soft on my skin. So I like this. This is great. I may keep doing this forever. Who knows? So that's about it. I know people want to get back to work, and we don't want to destroy our economy from this. We also have to think about the fact that even though young people probably won't die of it, there are some young people that get really, really sick, and we have to figure out who they are so that we can protect them, maybe wait for an immunization before they go back to work. Or, we need to figure out, and that still is being studied by infectious disease specialists and epidemiologists to figure out who really are the vulnerable people. Because even though it says the death rate is low for the younger people, and I mean like in your 20s, 30s, and 40s, that's young. Trust me, that's young. If you get it, that there's still of those groups, there's maybe 20% needing oxygen or needing some medical care. I know there's a lot of people, and this is great, that are just having mild symptoms, and that's awesome. I hope we all have mild symptoms, but there are still those people that are going to need the hospitals, and we don't have that many hospital beds. So we still need to stay strong with the quarantine. I know you're getting bored or frustrated or maybe frightened. Don't be frightened. It's going to be okay. But, also be patient. Be patient with this process, and we'll get through this. Okay. So that's Grandma Shark saying COVID-19 update, and I'm off to the front lines. Talk to you later. Please subscribe to my YouTube channel. Thanks. All right, how do I end this? Oh, there we go.